Hi, it's Dr. William. I'm here with a patient. She's 6 months out from having a tummy tuck, and I just wanted to talk a little bit about a belly button and this location and how it looks and things like that. So first of all, if I just look at her belly button, I cannot change the height of her belly button. So some people have a high riding belly button and other patients have a low riding belly button. Hers is really kind of normal position. And even if it's higher or lower, it's still normal. There's variability with everybody as to where the belly button is located. Typically it comes over here where we're at the top of her hip. That's pretty common. And so that's about where it is with her. She has some scarring around the belly button. Most of the scarring from the surgery is hidden on the inside. If I just move that back a little bit, see how you can see some of that scarring that's there on the inside, but it's hidden because she's got a nice little hood, what we call this hooding, which I like. I learned this technique from Dr. Zen years and years ago when I was at Duke. She does have some other scarring though, and this one is from her gastric sleeve. That one's from her gastric sleeve. And this one here, this lower one, see that little dark spot there? That's actually from a piercing that she had a long time ago. People always ask me about scarring around the belly button, how it's going to look, these types of things. But I can tell you what gives you the worst scarring is belly button piercing. I don't have any daughters. I have 3 boys. None of them have their belly button pierced. But if I did have a girl, then I would say, hey, I would suggest not getting a belly button piercing because typically from what I've seen, the scarring is not very good. She probably would go ahead and get it anyway. You know, that's what that's from. She didn't have that scarring. She still would have a little bit of scar here that you can see, the one that I made. But in general, the scarring is pretty well concealed around a belly button with this sort of natural hooding technique. And I personally like the way her belly button looks because I think it just looks natural and it's more of an innie. And we're going to go on and do liposuction. So I'm going to actually remove the fat that's here that's underneath. And she doesn't have any more excess skin because of the tummy tuck. So I'm going to be able to lipo all of this. And what will that do to the belly button? Well, what it'll do is it's just going to thin out the fat that's here. So everything will look the same, but it's just going to shrink a little bit. And in her situation, I'm going to leave a tiny bit of fat around here because if you take all of the fat in that area after a tummy tuck, then we have a nice innie here and we have some of that hooding over top. But if we just take all of the fat, then her belly button is just going to become very flat. The people that really get a belly button from a tummy tuck are those that actually have a little bit of fat, because in order to be able to get the innie, to be able to get that invagination, you need to have a little bit of fat on the surrounding area so that there's some place for that belly button to go. All of the fat is removed, then your belly button is just kind of flat and you can't get any sort of architecture or curve or structure to it. So when we do that, we'll leave a little bit here. And sometimes we call this the halo. You'll see sometimes patients will have a little halo of fat around their belly button. And it's very natural. Even if you look at models, I did this years ago, went through some Sports Illustrated swimsuit models. I did that when I was very young, when I used to get my Sports Illustrated. I was an avid reader, but I was looking at them and you can see halos on women that are thin and have never had any lipo or anything, and they still have a halo. It's a nice look in some patients. So we'll do that when we do the lipo, just to leave a little bit of fat here, just to prevent that belly button from just kind of collapsing, getting flat, and that'll preserve her inniness and her hooding that's here.